Welcome to Everything Neuropathy with Momentum Health Neuropathy Center. Your journey to relief? It starts here. My name is Dr. Karen May, and I am your host for today's Everything Neuropathy. Now, these videos give great information, but do not constitute medical advice. So please talk to your doctor if you need medical advice. But on today's Everything Neuropathy, we're talking about radiation-induced neuropathy. Neuropathy is a chronic condition causing nerve damage, and it leaves people living in chronic discomfort and many times pain, but a quality of life that's going downhill. But there's over 100 different causes, and most people associate neuropathy with diabetes, but like I said, 100 different causes, and surgery was mine. Chemotherapy, radiation, chemical toxicity, trauma, there's over 100. So please know that just because you've had cancer and no chemotherapy, you can still get neuropathy. In fact, Pardee and al., in some of the research articles that I was reading, talk about how it can happen 4 to 6 years after your last radiation. No chemotherapy even needed. And that's how long it can take for neuropathy symptoms to show up. Here's the deal though, is most doctors or clinicians kind of miss the boat a little bit and misdiagnose it because you come through your cancer diagnosis, you're almost into remission or maybe into remission, so they're not even thinking the connection. And so they may misdiagnose it, and so you may have to push it a little bit. So talk to your doctor about that. But the other thing is they're looking at what causes it, and they're not quite certain. So that the radiation can cause something called fibrosis or radiation-induced fibrosis. And what's fibrosis? It's a scarring or a thickening of connective tissue. So what they're proposing is it causes neuropathy in 3 different ways. Ischemia, which means there's not getting blood flow to those nerves. Oxidative stress, meaning your body's breaking down faster than it's repairing and damaging those nerves. And the third one is inflammation. Well, think about it this way. Ischemia, we've talked about this numerous times, how if you cannot get blood flow to a nerve, what's going to happen? It's going to die. So that's a potential to heal and repair that blood flow. The second thing is oxidative stress. Got to use food as medicine, because right now, if you're breaking down faster than you're repairing, that's that oxidative stress, and you got to get good nutrients in using food as medicine. We got videos on that too. But then it talks about inflammation. Again, you've heard me say inflammation is the root of every chronic disease, and you are much in control of how much inflammation you're putting into your body by what you eat. So part of that healing journey is actually reducing inflammation by using food as medicine. Now, regardless of the cause, you need to ask yourself a couple questions. The first one is what is your body's ability to heal and repair those nerves? And what's it going to take to heal and repair those nerves? And the third question is your body breaking down faster than it's repairing? If you came through cancer but have all these other chronic illnesses or on a host of medications, that's an indicator that your body's breaking down faster than it's repairing. But the question is what's it going to take to repair? And so understanding your journey that you've had with neuropathy so far will help us to understand what options are available to you and what are realistic expectations for improvement. Because at Momentum, we go beyond the common medication methods and focus on healing nerve pathways by addressing the inside, reducing inflammation, getting better blood flow, and then you can focus on healing nerves so that way you can have the relief you're looking for. So are you struggling? Had radiation, think you have neuropathy but don't know? Give our office a call, 517-883-2291, and my team can set you up with an evaluation with one of our relief experts and help to start to plan relief options for you today. Have a great day, and God bless.